Hello, friends. Our first video is dedicated to a remarkable story featuring a GI medical oncologist, Dr. Michael Raphael, from the Odette Cancer Center at Sunnybrook Health Sciences Center, a center filled with compassionate and caring experts. And our stage 4 CRAN patient, Miss Anna Bettencourt, who was distraught to learn that she had failed first-line standard of care therapy after just a couple of months. But Dr. Raphael was determined to identify a promising clinical trial that contained an immunotherapeutic, pembrolizumab, that would specifically target Anna's tumor mutation that today has brought Anna to the point where she is treatment-free and living life to the fullest with so much joy in her heart and so much hope. She has a great quality of life, renewed hope, and much appreciation for Dr. Raphael and the team at the Odette Cancer Center. Facilitating the discussion is Ms. Anne-Marie Wright from Unlimited, who does a great job of bringing out the more salient points of the relationship between the treating oncologist and grateful patient. Sit back, my friends, and expect to be inspired by a humble yet remarkable clinician who made a significant difference in the life of a stage 4 patient. Thank you.
Dr. Michael Raphael is the medical oncology lead for the hepatic arterial infusion pump chemotherapy program at Sunnybrook Health Sciences Center for patients who are diagnosed with unresectable colorectal cancer liver metastases. This is a unique program offered only at Sunnybrook's Odette Cancer Center. Dr. Raphael is also the head of the GI Medical Oncology Clinical Trials Program at Sunnybrook, offering metastatic patients hope after exhausting standard of care therapies. Dr. Raphael is also a valued member of CRAN's Medical and Scientific Advisory Board, wherein he judiciously counsels CRAN and keeps them abreast of the latest developments in the medical management of colorectal cancer. Please also welcome Anna Bettencourt. In June 2019, at the age of 46, and after suffering from abdominal pains and incessant vomiting, Anna was taken to the local emergency room, where she was surprisingly diagnosed with colon cancer. 1 month later, it was confirmed that her disease was stage 4, with metastatic disease to her liver and peritoneum. Anna's first-line treatment was not successful for reasons she will share with us. Anna qualified for immunotherapy, which she went on to access through a study. And through this study, this is where she and Dr. Raphael connected. We're thrilled to report that Anna's disease responded remarkably well to this therapy. And today she is vibrantly alive and committed to sharing her story to help others. This is a magnificent story of how an incredible clinician helped a patient to get their life back. So without further ado, I'm going to turn the floor over to Dr. Raphael. Dr. Raphael, let me start with a question for you. We'd just like to know more about your practice and how you help metastatic patients.
Thank you for the kind introduction, and it's my honor to be here today with one of my superstar patients like Anna. As you mentioned in the introduction, I'm a medical oncologist at the Odette Cancer Center, and my entire practice is dedicated to the care of patients with gastrointestinal malignancies. And through my practice, what I want to do is to try to give every patient the sort of outcome that Anna has achieved. I want to try and help patients feel better. I want to try and help improve their quality of life. I want to try and help them live better. And a large part of doing that is trying to find the right treatment for the right individual patient in front of us.
Thank you so much for sharing that. And I am now going to ask Anna to share more about her wonderful story. I happen to be in a very privileged place to have known some of this story, but I know that you will share it beautifully as you always do. Please tell us a little bit more about your journey.
Thank you so much, Anne-Marie and Dr. Raphael, for this opportunity. So yes, my journey started in the early June of 2019. I was busy. I had a busy career, stressful career, and also we were doing a large renovation in our home. And during that time, I was feeling sharp pains in my stomach, but I thought it was because of the stress of work and of our renovation. And so I went to my doctor and basically told her what was wrong. And she agreed, and she sent me off with recommendations, some probiotics and some needed rest. So I took her advice. I took the probiotics, and I decided to, go to my mother's house and, spend some quality family time with her. But after some time, and again, I wasn't sleeping well and I wasn't feeling any better. And I started vomiting black matter. And so we rushed, and my mother lives in Ajax. So we rushed to the emergency hospital where I was told that I had a grapefruit-sized tumor in my colon, which the surgeon had said that it was had been growing inside me for 8 to 10 years. And of course, big surprise to me, cancer was not on my mind at the time at all, but I had cancer in my life before in 1999 with non-Hodgkin's lymphoma, which I was successfully treated for and kind of put it out of my mind. And my doctor and I had started early breast screening because of my cancer history, but no one had ever told me. And I didn't know, and that I should have also been screened for other cancers, including colon cancer. So I had never done a colonoscopy before. Again, I was 46, and in Ontario, we only start screening at the age of 50. So I wasn't even at the age of screening yet. So again, to my surprise, colon cancer, this is something old people get, old men get, and I don't even know where I got this idea from, but I was very, very surprised with this diagnosis. And they did tell me that it was quite large, and the surgeon was not very experienced, and said that it might not be, he might not be able to remove it, and I might have to go into palliative care. So stress and everything, of course, came into my life, not knowing if I was going to live. But he did say that he was going to talk to his colleagues and so on and so forth. But in the meantime, my tumor became septic, and it had to be removed, or I was going to die. So the emergency surgery, which they thought was very successful. They thought they had removed actually all the cancer, and I would probably just would have to do a little bit of chemotherapy. I was in the hospital for over a month, recovering from the surgery, and we kept doing tests, CT scans and so on. And when they told me that my cancer had spread, has metastasized to my liver, which now had complicated matters. And I needed to start treatment right away. My surgeon, again in Ajax, had contacted a large hospital here in Toronto, because I live in Toronto. And to my surprise, I was denied treatment. And I was very distraught. I thought this was the end. With the help of CRAN and my family doctor, we contacted Sunnybrook Hospital, where Dr. Raphael, came to my rescue. And I'm so grateful for that. I was very nervous, and Philomena from CRAN can tell you, I was very nervous to meet Dr. Raphael. I know I needed to hear what he had to say, but I was very scared. I was very scared of my outcome, of what he had to say, and so we started 9 rounds of chemotherapy, and I'll talk a little bit more about our relationship later on, but you know,
Dr. Raphael, what was your immediate reaction to, and how did that first meeting go when you first met Anna? Certainly a complex case on many levels.
Yeah, it's really something to hear Anna tell the story again, and you get emotional hearing the story about all that she's been through. And unfortunately, Anna's story is something that I see very frequently in my clinical practice. A lot of my practice does involve taking care of younger patients who are diagnosed with cancers, and in particular, younger patients who are diagnosed with metastatic cancers. And so this is a very difficult part of the job, is going into the room and meeting a young patient like Anna for the first time and needing to tell them about such a serious diagnosis, and needing to tell them that we need to get on treatment in order to try and get this under control. And for many patients, it's unfortunately telling them that there's not a cure for this cancer, and that what we're doing is going to be to try to control this cancer for as long as possible. So every time I get these referrals, no matter how often it is, it makes me stressed, it makes me anxious, and I'm worried about that. And I always reflect on, if I'm feeling that way, just imagine how the patient and the family are feeling as well. And so when I approach these sort of conversations, I try to be as honest as I can. I try to be as compassionate as I can. I try to find the areas for hope, because no matter what the situation is, there is always something that we can be hopeful for. Whether it's getting on a treatment that helps someone feel a bit better, get them on a treatment that helps them live to a point in their life that they're really looking forward to, whether it's a wedding or an upcoming birth or something that's important. These are the sort of things that I really try to highlight, because no matter how serious the diagnosis and no matter how few or many the treatments are, you have to leave that first visit with some hope that there's going to be improvements in the coming days to coming months.